Thank you for a nice introduction. First of all, thank you very much for inviting me for this meaningful international symposium. And I want to give some congratulations again, this 40 years anniversary of SGL. Today I would like to talk about the oral microbiome and inflammation connection to systemic disease. Today's my presentation, I will introduce the three topics. The first topic is what is the major differences between the oral microbiome and gut microbiome research. Secondly, I want to introduce the importance of the screening test and the application of oral disease detections. Finally, I will introduce the oral microbiome research using the fluorescence technology. Maybe it's the whole day meeting you already know that the gut microbiome is very important. The oral cavity is the first gateway in the whole digestive system. However, most of research really focus on the gut microbiome research. But the oral cavity is also lots of bacteria. So we need to understand what's the difference in the oral and gut microbiome research. First major difference point is sampling characteristics. Gut microbiome research, you already know that the whole digestive system there are different microbiome exist. However, it is very difficult to collect directly. So most of the gut microbiome research mainly use the feces sample. However, oral cavity is very easy to assess. So there are lots of teeth and the parental tissue, tongue, and mucosa. So this kind of different portion also have the different type of bacteria exist. For example, the representative oral disease is the dental caries and the parental disease. Dental caries related to bacteria such as the Streptococcus mutans, we already know that, and also parental disease, some bacteria also exist. However, two bacteria is completely different. Like this kind of thing, difference is like this. Recently, many researchers evaluated what kind of oral microbiome existed in the different portion. For example, the subgingival plaque and supragingival plaque and the keratinized gingiva and the hard plate and the tongue, saliva. Mainly, we can easily detect the Streptococcus mutans, Streptococcus species. However, the other special oral microbiome exists in the different part. This is very important. We can analyze the plaque and tongue and keratinized gingiva. You can see the variety of oral microbiome exists. Main reason is this bacteria is preferred to the oxygen saturation, pH, and nutrient. Such kind of lesion is maybe big differences exist. Secondly, I want to introduce this histological difference in gut microbiome and research and oral microbiome. Left figure shows some intestinal epithelium. So you can see the intestinal epithelium is closely connected to each other using the tight junction and the adherent junction and the desmosome. This kind of junction strongly prevent the penetration of the bacteria from outside of the intestine. However, it's a right side figure. You can see there's some tooth and the gingiva. There are naturally exist some circus crevice exist. We can call it as the gingival circus. But it's the most bottom part of the gingival circus, we can find out the junctional epithelium structure. Interestingly, junctional epithelium have the very loose cell connection, such as the hemidesmosome. This is not common in the intestinal tissue. So this kind of figure also introduced some increased intestinal permeability. So maybe left figure shows the symbiosis situation. Intestinal epithelium over lots of mucus layer, they prevent the penetration of bacteria. But it's the gut microbiome changed to the dysbiosis. This mucus layer is decreased, and some intestinal cell junction is the weak and loose. Finally, is the pathogenic phenomenon happen. This similar phenomenon also occur in the oral cavity. So, as I mentioned before, as the junctional epithelium is the bottom of the gingival sulcus. So, for example, is the healthy tissue. This is I can compare some permeability of this healthy tissue is some cotton cloth. However, parental disease situation, in that case, permeability rapidly increase, and this kind of mesh cloth is a similar structure. That's why, as some researchers say, this kind of the leaky gum, and why is the parental disease strongly correlated with some cardiovascular disease and some preterm births like this. So main reason is this kind of histological difference in the gingival tissue. Second part is I want to introduce the lesson from the COVID-19. Last 3 years, we are very suffer from some COVID-19, but we can get a very meaningful lesson from the COVID-19. I think one of the important lesson is maybe screening test. If the disease is discovered in the late stages, treatment becomes very difficult. So it is necessary to develop the screening technology capable of the detection of all these stages. So the most important part of the screening test is the real-time assessment. This is very meaningful. So we can compare the traffic light system. Health is the green light, and the disease is the red light. Maybe it's the screening test is play a similar role as the yellow light. Disease is a kind of spectrum, so from health to disease. So as I mentioned before, green, yellow, and disease. So maybe screening tests belong to some intermediate parts, is the subclinical stages. Last COVID-19 period, we can use the screening tests such as the temperature measurement and a simple home test. But finally, some screening test positive, we can use the diagnosis and by PCR. However, in dentistry, is a different situation. Oral cavity, lots of oral microbiome exist. This oral microbiome also make the oral biofilm. We can call it as the dental plaque. This dental plaque can produce sometimes the dental caries, sometimes parental disease. Then like this. But this kind of disease spectrum in the conventional and traditional dentistry, we only use some dentist naked eye and the X-ray. That is the diagnostic tool. We don't have the screening test in dentistry. However, in medical field, the screening test is very popular. For example, the diabetes. Maybe before the 1979, is the fasting glucose level over the 140 we can diagnose as diabetes patient. However, as the 1997, and this kind of level is the decrease in the 126. Also, they developed some pre-diabetes category. It means the kind of a screening. So we can get some meaningful lesson from this kind of screening test before. This is kind of some big iceberg of oral disease. So upper part of the cell level, so we can call it as the clinical phase. Underneath part is the subclinical phase. For example, cavity dental caries lesion and parental disease located in the upper part. But what is the most deeper part of this iceberg? Maybe oral microbiome. Oral microbiome accumulate and make the layer. They can make some oral biofilm. One pathway is to dissolve, produce the acid, and they dissolve the enamel and the tooth structure. We can call it as this is a dental caries pathway. The other pathway is also oral microbiome, also make some inflammation in the host tissue surrounding parental tissue, then make some inflammation, they resolve the alveolar bone, finally, so we can find out the parental disease. But we can find out the common stages, such as the oral biofilm stages. So, if we detected some oral biome stages, is a specialized bacteria metabolite by a specialized optical assessment. This is a very meaningful real-time assessment. Our research team is really focused on this kind of development of fluorescent technology. We can call it as quantitative light-induced fluorescence, QLF. So this kind of technology used natural blue light, and also we use the autofluorescence phenomenon. So we don't need to dye, we don't need staining, just light is easy. If we irradiate the 4 or 5 nanometers visible blue light in the tooth and the gingival structure, and in that time we can combine with some specialized filter together, we can find out the strong red fluorescence from the microbiome. So we can easily detect some bad situation from the oral biofilm. The main reason is the bacteria produce the porphyrin. So I can explain later again. This kind of QLF technology can have the two kinds of different principle. First principle is this technology can detect the mineral content of the tooth structure. So every natural tooth have the autofluorescence. If you irradiate 4 or 5 nanometer blue visible lights, we can see some green fluorescence from the tooth structure. But there are some tooth structure have the caries. We can see some fluorescent loss. So in that time, we can detect the caries exist. Second meaningful principle is the bacterial activity. So every bacteria or a microbiome also have some porphyrin. So if you irradiate this blue light, we can easily detect the red fluorescence. This kind of also autofluorescence phenomenon. So it's this kind of technology can detect the mineral content in the tooth structure, also bacterial activity together. So you can see there's some strong red fluorescence from the dental plaque and calculus and the caries lesion and the crack and oral malodor. I can explain the mechanism why is this kind of red fluorescence phenomenon happen. Biofilm are divided into early colonizer and late colonizer. So you can see some bottom line is tooth structure, then salivary acquired particle, then early colonizer such as some Streptococcus species is easily attached to early colonizer. Then Fusobacterium nucleatum is a very interesting species of oral bacteria. This is a kind of some connection between the early colonizer and late colonizer. Late colonizers mainly consist of the periodontal disease-related bacteria. Porphyrin is the chemical structure with the 4 pillars. Hemoglobin in animal blood and the chlorophyll in plants are representative of porphyrin structure. Interestingly, bacterial porphyrin, also called as protoporphyrin 9, also bacteria produced, especially anaerobic and the gram-negative bacteria is produced protoporphyrin 9. Then, if you irradiate the blue light, we can see like this kind of strong red fluorescence from some oral cavity. We have a we have an experiment like this. We incubated during 10 days using the human dental plaque. Interestingly, red fluorescence was detected from the biofilm mature over 3 days. It means if you look at some strong red fluorescence from the dental plaque, this biofilm accumulates at least 3 days more. We also have an interesting human study. We collected 2 samples. One sample is the non-fluorescent plaque. The other sample is the red fluorescent plaque from same subject. Then we compared what kind of bacteria exist inside of this. So red fluorescent plaque is the lots of parental disease bacteria exist. So we can say red fluorescent biofilm in QLab shows a much more diverse microbial distribution, and many periodontopathic bacteria exist inside. We also have another clinical study using some dental floss. Interproximal area in the molar area is so old biofilm sometimes exists if some patient don't use the dental floss. There are very old and harmful bacteria exist inside between the tooth. In that time, we collected this biofilm using dental floss. We divided 3 groups: healthy group, gingivitis group, and periodontitis group. Then we collected some tooth floss and sample like this. We compared the red fluorescence. So we can say the red fluorescence of interdental plaque is the posterior teeth is useful indicator to evaluate the periodontal tissue. Nowadays, after the COVID, many people realize that some bad breath. So main reason of bad breath is originate from the tongue biofilm and interdental biofilm. So we take the image by QLab to the tongue and interdental biofilm using dental floss. We collected this kind of red fluorescence intensity in area. We make some combined plaque fluorescence score. In that time, we compared this fluorescence image data with some conventional organoleptic score and some volatile sulfur compound. Then we can find out the meaningful and moderate correlation. So we can say that this is a very useful tool to evaluate the bad breath. Recently, the dental implant is a very popular treatment in dentistry, but it's sometimes dentists have to treat by some bone augmentation, but sometimes the surgical failure is happen. During the bone grafting surgery for implant placement, some surgical failure happen. In that time, bacterial infection is happen. So in that time, we can easily detect the bacterial infection by red fluorescence. So this is one of the useful clinical application. Also, nowadays, some patient has some medicine-related some osteoporosis, osteonecrosis has happened. In that time, oral surgeon have to decide which margin is have to divide it in the jaw bone. So in that time, during the surgery, jaw necrosis, it is very difficult to visually distinguish between the bacterial infection and the normal bone margin. But in this time, this kind of fluorescence technology can help to easily distinguish through the red fluorescence. So we can, oral surgeon easily detect some bone cutting margin. Nowadays, we expanded this kind of some fluorescence from the oral biofilm to some, how can we decrease in the pneumonia in patient? Pneumonia is defined as the inflammation of lung tissue. The main cause is the microbial infection. So we have, our department have a strong collaboration with the geriatric medicine in Severance Hospital. We visited each patient and we cleaned the tooth and oral cavity like this. But one of the problems is this is a food debris. Food debris is easy to detect with our eye. However, the oral biofilm is very difficult to detect with our eye. So we applied this kind of technology to like this. So palate area, some mucosa biofilm is covered. In that time, we can easily detect the red fluorescence. Then we also compare the red intensity using compared to the white light image and fluorescent image together. We can say the mucosa biofilm can be detected 5 times more easily when observed with the fluorescence technology. So it means we can easily remove some oral biofilm in this patient, like this. Yeah, I already mentioned that the oral disease iceberg may be upper part of the clinical stage and the lower part of the subclinical stages. Maybe our fluorescent technology located this part. But most of microbiologists really focused on the detection of the culture of key pathogenic bacteria. But nowadays, NGS technology is located most bottom part. But I want to have how about this apply the fluorescent technology to the key pathogenic bacteria finding. So this is a very famous model for the periodontal disease-related bacteria. 1998, Sokransky firstly proposed this kind of model. Maybe most harmful bacteria belong to the red complex, Pulpiromonas gingivalis, Tannerella porcidia, and Treponema denticola. So maybe many researchers really focus on the Pulpiromonas gingivalis. But interestingly, the orange complex is a very interesting kind of group. So especially Fusobacterium nucleatum. I already mentioned that this bacteria is intermediate species between the early colonizer and late colonizer. So our research team is also focused on this kind of the bacteria detection. Fusobacterium nucleatum is commonly found in the oral cavity, but this bacteria belong to the orange complex and a cause of the periodontal disease. Interestingly, 2012, as the caustic firstly proposed, this bacteria have some relationship with the colorectal cancer. After that, many researchers reported that this bacteria is the strong correlation with colorectal cancer. So it's very meaningful to find out this bacteria by fluorescence technology. Our human eye can only detect the visible light wavelengths from 400 to 700 nanometer. However, if we use some hyperspectral imaging technology, we can see from 200 to 1,300 nanometer. So we can expand our visible area using this technology. In this study, we evaluated the fluorescence pattern from some 6 representative oral microbiome, some actinomyces and lactobacillus fusionucleatum and streptococcus together. Then you can see this kind of fluorescence chart showed x-axis is emission wavelengths, y-axis is excitation wavelengths. So this kind of excitation and emission metrics, we can distinguish each bacteria by some pattern of fluorescence. We can apply this kind of pattern to make a specialized filter. White light images, we cannot distinguish each bacteria. But some filter 1, some filter 2, so we can distinguish this kind of bacteria. This is a very useful tool in screening test in the clinical field. Yes, during my presentation, I introduced some parental disease bacteria easily penetrated some oral junction epithelium, then easily penetrated the blood vessel. They can travel easily to the some important organ. So that's why this parental disease is related with diabetes, cardiovascular disease, and Alzheimer, and respiratory disease like that. So I think the main reason is from the oral biofilm. So in this case, if we remove the oral biofilm completely, we can dramatically reduce this kind of disease. Also, this kind of fluorescent technology to apply the distinguish of the each key pathogenic bacteria in the future. Thank you very much for your attention.